Joining us now is Dr. James Fanale. He is the CEO and President of Care New England. Dr. Fanale, thank you so much for joining us today.
Thank you.
Now, I know we have a lot going on across the system here at Care New England. Can you give us the latest update?
Sure. Well, thanks for having me. There's a lot going on, as you can tell. We're monitoring every day the spread of the virus and the impact it has on our hospitals, our physician group, the VNA, et cetera. So we're doing that day to day. We're also planning. Most of the planning now is on making sure we're ready for the different elements of surge, different levels of surge. So what happens when we get growth in patient volume that we're full? How do we prepare to accommodate 120% of capacity? How do we accommodate 150% of capacity? So most of the work today is done on being prepared for when the volume starts increasing.
Now, will the state of Rhode Island be providing additional ventilators to Care New England?
So it's a very good question. So far, we know that the state has stockpiles, an overused word, but they have a bunch of ventilators that they're beginning to distribute to the hospitals in the state. So we received a handful of those. At Kent Hospital, we have 31 ventilators there now. They're half used. But we're preparing that we could be able to double our capacity of ventilated patients. We also have the ability to surge at W&I, and how many vents could we put there? So right now, we're able to take care for the current volume, but we're working closely with the state to release more of those ventilators so the other Rhode Island hospitals and we can have enough.
Can you touch upon the site opening at Memorial Hospital?
We opened a respiratory intensive treatment unit, we call it, or RE2, and that was open to Kent, and it was intended to see patients in the community that had respiratory illnesses. When people had respiratory illnesses, we really didn't want them to go to the emergency room necessarily. And so the offices weren't equipped to take care of them because they didn't have enough personal protective equipment. So we set this up, and in a tent at Kent, basically patients are appointed, it's full. Patients are coming there, being seen, treated appropriately, assessed appropriately, and if it's indicated to do a swab, they get a swab. Not everybody gets a swab. It's not a swabbing site. Realizing that the Blackstone Valley has a different population, they're not as mobile, transportation can be an issue. It's kind of tough to say to the people of Blackstone Valley, take a bus to Providence at the same time, tell them don't get on public transportation unless you necessarily have to. So we took the same concept to Kent and opened it this morning at Memorial. Again, a respiratory intensive treatment unit for patients with respiratory illnesses who, if appropriate, will also be swabbed and cultured.
Dr. Fanale, across the system, no doubt we've seen doctors, nurses, staff working so hard to care for patients. What have you seen personally that makes you so proud to be the CEO of Care New England?
Well, that's the whole name of the game. I haven't been visiting the operating units of hospitals as much as I usually do because, you don't want to get in the way. You're afraid of all the infection potential. But importantly, people are going above and beyond. They're dedicated to our patients. They're doing everything they can. On the management side of things, folks are working 2 or 3 full-time jobs. I jokingly say people are working 24 hours a day, 8 days a week, because they all are. The staff is gearing up. About a week or 2 ago, I did walk through the emergency room at Kent, and everybody's walking around masked, but it's as if it's just their daily job. They know what they got to do, and they're doing it. And it's astonishing to see. You kind of expect it from healthcare workers because we've all been doing this for our entire lives. That's why we went into it. But it's just astonishing to do it. And you call someone and we need to do X, Y, and Z. They're all stepping up to do it. It's incredible, endearing. It makes the stuff that we do and planning the stuff look kind of small, but that's what drives us. It drives us the fact that we got to take care of patients well, and our staff is overwhelmingly dedicated to doing that the right thing. So proud is probably too nice of a word, too small of a word to say. So it's pretty exciting.
Care New England has also been the recipient of many donations to local hospitals, whether it be masks, PPE, food donations. What do you want to say to the people out there that have donated to your hospitals?
I think it's also incredible. There are vendors down in the Warwick region bringing food to our nurses and staff. Some of the legislators have stood up to do that. We have hardware stores and vendors that found they have N95 masks they're sending to us. One of our benefactors has a friend that has another company in Canada that was making masks, and we were able to order 200,000 of them. So everybody's pulling together. You know, the Champlain Foundation funded some of the equipment. They've come through with a process that's amazingly quick. The other foundations in town. So it's been an incredible outpouring of support from the community, from people that own stores that can find masks, to food vendors donating food, to corporations finding an ability to support us financially. So I know Lifespan and the others feel the same way. We wouldn't have been able to do this without. So this is really the community coming together, and it's been astonishingly positive and really makes you happy to work here.
Dr. James Fanale, President and CEO of Care New England, thank you so much for joining us today.
Thank you very much, Raina.